Okay, well, our next guest is here, so why don't we bring her on the stream? Erika, what's up?
Hi.
It's been a while since we've talked on video. I think since the
Since you did, our event
the event,
with
right, with
Assembly Member Santiago. Yeah.
Right. Yeah. So a lot has went down since then. So first off, how have you been doing? What's been going on with you? Just before we kind of dive into CalCare, what has Healthcare LA been up to? Why don't you kind of just introduce that to my viewers and let them know what's up with that?
Sure. Well, first of all, thank you for having me on, not only to discuss CalCare and to be here to represent Healthcare for All Los Angeles, but you've also made me cool in the eyes of my 13-year-old son, which I really appreciate you for. So he was like, "You're going on a football player's podcast?" I'm like, "Yeah."
Yeah, I get that sometimes.
So
13-year-olds think I'm a lot cooler than I am, promise.
So we've been what we've been focused on at Healthcare for All Los Angeles is, as you know, we are single-minded for single payer, and putting everything we have into supporting the California Single Payer Bill, the Guaranteed Healthcare for All Act, otherwise known as CalCare. And let's just say it's been delayed, but it's still alive. It's now a 2-year bill. And so the positive way of looking at this is we have 8 months to rally the people and to demand that the assembly members pass this bill and then do it all over with the Senate members. It's disappointing. The nurses put out a statement. They were not happy with this decision to delay the bill. We certainly were not happy about it. And, you know, for a party that has single payer in their platform, right? So it's in the the California Democratic Party platform.
Yep.
We have a Democratic supermajority in the Assembly, a Democratic supermajority in the Senate, and a governor who campaigned specifically on single payer. The fact that we're having to fight this hard, I mean, it should have just like sailed through. It should have been like, here's a bill where all the members, you know, of the legislature are getting free chocolate, and be like, oh yeah, I'll sign that. Yeah. I mean, it's ridiculous. And, you know, we're seeing the same patterns that we've seen before, but we are in a different place that we've been before. We have, I think it's like 55% of the California population support single payer. So that doesn't matter which party you're on, so over half the population, but over 80% of Democrats support single payer. And you know, so we've got the Democrats completely in power. There are no Republicans to blame for why this bill has not advanced. And we are still in a pandemic. We're in a crisis. And now we have been in a healthcare crisis long before the pandemic.
Right.
But like, cameras have exposed the state-sanctioned violence of the police against Black and Brown and Indigenous community members, to those who had the luxury not to see it before. COVID is doing the same thing for our healthcare system. It is merely exposing the incredible inequity and cruelty of our healthcare system, and it has also exacerbated it. So
what? I mean, I think that point is spot on. And why do you think there's no, you know, lever or mechanism for, you know, let's stick with California and Democrats in California who, you know, support this legislation, see something like CalCare is up, and then it just gets tabled. Like, what do you think? How do you think that plays with, the California public? And how is it that they can just do that, right? Not actually support legislation that's in their platform is in, in the system, trying to go through, right? Trying to actually get up to the governor's desk. And then it just doesn't. Like, how do you think that plays with the California public, who is so for and desperately needs, especially after COVID, right? Something like CalCare to go through.
So I think that with so many of us, so let me just put it to you like this. We saw how huge, as Bernie Sanders would say, he won the state of California during the primaries in this past election. And there were, and just so you know, I was president of a local Democratic club for 3 years. Back in 2016, I was a delegate for Bernie Sanders. And then I was an elected assembly delegate twice because I was trying to move the party to the left. Mm-hmm. So I've been on the inside a little bit. And there were shenanigans, and still Bernie Sanders won so big that he won the state huge. And the governor is facing a recall. If Governor Newsom used his platform and used his power and came out and said to his super majority Democratic legislature, I want AB 1400 CalCare on my desk, it would most likely get there. Right. And you would see people rallying as huge as they did for Bernie Sanders, who won this state, to support him and not being recalled. So what you're seeing is like a lot of people being like, yeah, maybe I don't want him to get recalled, but and I got to go pick up my kids from school, so I can't really be bothered.
Exactly, and that's exactly why the Democrats lose elections, right? Not because they have a disadvantage, because the people that they're supposed to be getting in their coalition, right, are disaffected, are depressed, and don't come and turn out when they have these busy lives, right?
And why would we, when he's not? I mean, if he were to lead us to have CalCare, you would have people do what it takes to get out in the streets to support him. There are the Democratic tribalists who are doing that, but I'm seeing beyond, because instead of just talking the talk, he'd be walking the walk and actually giving people what they need. We're in the middle of a pandemic. To give your people health care, right? I mean, to deny them of health care is unbelievable. And by the way, but not supporting this bill is effectively denying people health care. And what is so disappointing is that these Democratic members of the legislature, they have no sense of urgency.
None. They
don't. We'll just push it to this, and it's disheartening, but not so much so that we need our people in the streets, and that is how we think. What to get this done, that's what it's going to take. It's going to take, so many of us in the streets demanding that they do this, and if they don't, not supporting them.
Yeah, no, that's where we have to get. That's the point we have to get to. That's the point we have to get people in this country to, right? Where they're not going to continue to support these people like the Democrats, who have a super majority in California and have had that for a long time now. Until they actually give the people something back, right? So when you have, and I was just speaking about this a little earlier before you came on, but with this $38 billion surplus that the governor recently just announced that the state has, and the fact that we know that 70% of the California health insurance is already paid for by public dollars, right? So you're really looking at a 30% funding, which is what they keep tabling this bill because like they don't know where the funding is. Well, I'm like, that's $38 billion that can go towards helping that funding gap, right? If they actually were about passing something like CalCare, if Newsom was actually about that. Now, what he's going to do is he's going to give people a $600 stimulus check, right? With that $38 billion, he's going to give it out. And some people are saying, well, he's out there buying votes. And I'd say, yeah, probably. But but instead of actually putting that towards something that would take away their health care bills every year, which would be a lot more than $600, instead of doing something like that, he's just going to, do this little stimulus program and then still act like we can't afford to have something like that would be cheaper than what we have now. We can't afford something cheaper like CalCare.
You are
what are your
right.
thoughts on that?
Well, I think you're exactly right. And it's important that you point out that all the healthcare costs in California, 71% of those costs are publicly funded. But right now they're privately managed. And with CalCare, so what you're saying, it's only about 29% that we need to find funding for. And actually it's less than 29% because of the savings, right? So if you look at Medicare, right, the overhead is only 3% for administrative costs, whereas with private insurance companies, it's like something like 20 to 30%. So it's actually even less than 29%. If SB 562, the single payer bill that was around in 2017, also written by our nurses, shout out to our California nurses, we love you. If SB 562 had been implemented in 2017, by the end of 2020, the state of California would have saved $111 billion.
In 3 years.
111 billion. Wow. So that's even more than the surplus. Imagine how far that could go in housing our unhoused neighbors.
Imagine $111 billion. Like, you're solving the issues. You're solving all the issues that we can't afford to pay for. You're solving it just by instituting single payer healthcare. That's it. I mean, you have to think of California as like, it's one of the biggest economies in the world, right? So think of it as its own country, right? If we get single payer here, you'd be saving, like Erika said, $111 billion, and you could fix any issue you want. All those roads that are shitty in LA, fixed, right? Everyone who's unhoused is now housed. We're going to make LA beautiful, we'll make California. They could do all that. Put money towards, the climate to get rid of some of these wildfires. Anything, just by doing one thing. Passing single payer healthcare in California. What will these Democrats do? Not that. They're not going to do that.
There's so much, because all of these issues, they intersect, right? They're intersectional issues. And there's so much that this bill, CalCare, does to bring solutions to other areas. And as you pointed out, California is the world's 5th largest economy. So it's a much bigger economy than Canada's, and California is about roughly the same population. So they can do it, we can do it. And this is all, you'll hear it's not, there's no funding mechanism. Well, when we had SB 562, there was a study done, the Perry study, and it recommended 2 ways of financing SB 562. It was a 2.3% gross receipts tax, and it was on businesses $2 million or more, and it was a 2.3% luxury item tax. So essentials like rent, food, they were exempt. But there's all kinds of ways that you could fund this. You could have a, Texas has a drilling tax, right? When the companies come in and drill, they tax them on that. You could have a billionaire tax. There's so many different ways to fund this. And but talking about the intersectionality of this this bill, single payer. I was reading an article today, and there's a quote on it, and it said, let's be clear, passing Medicare for all is a racial justice issue, wrote Black Lives Matter in a statement endorsing Medicare for all. As the organization states, Black people, and especially Black women, have historically been and continue to be subject to a medical apartheid in the U.S., with substandard care and unequal access and expectations, in contrast to the care and standards white and other people are given. So it's another area. What we have right now, what our healthcare system is right now, is it is a caste system.
Yep.
Where it, says some lives, mostly wealthy and white, are valued more than other lives. And so you have penthouse care for those who can pay for it, and bargain basement care for everybody else. And what CalCare does is it ends this caste system, and it gives us a new healthcare system where basically the senator and the janitor receive the same high standard comprehensive care. And it's only when you have everybody in that you have, equitable healthcare. So that's another area where you see the intersection of single payer.
Yeah, I mean, I was listening to Bad Faith Podcast, and Brianna Joy Gray was talking about this. And it was that, something like Medicare for All disproportionately would give who healthcare that does not have healthcare or is underinsured at the moment. Mostly Black and brown people, right? Poor people. So this is a racial justice issue as well, right? And California has a very diverse population as well, especially the cities. So like you're just saying, this is a quintessential issue if you're actually talking about racial justice and racial equity. But in the most progressive state, we're not doing something like that, which we all know would have that effect.
This bill is such an incredible bill. I mentioned SB 562 earlier. By the way, this is the sixth attempt California has put forth in having single payer legislation. We had an event, by we I mean Healthcare for All Los Angeles, with Kip Sullivan and Dr. Jim Kahn, and they really they compare single payer bills all over the country, and CalCare is a gold standard single payer bill. It is such a thorough and thoughtful bill, but there is a section where it talks about it prioritizes funding for rural and underserved communities. And so, things like if you look at Beverly Hills, hospital, tons of doctors' offices, medical facilities, and then you go, into Inglewood and they're fighting to keep their hospital open. What CalCare does is it puts, hospitals, healthcare facilities. We know that delay can mean disastrous medical consequences and even death. Right. So having, hospitals and clinics in communities, in neighborhoods, this bill does that. And it's very important to our public health and our neighbors' health.
Does it allocate money? It allocates money to bolster those.
It prioritizes the allocating of money.
Wow.
So, it's a really amazing bill.
Be unbelievably life. It's, I was just talking to Christina Olivo. I think that's how you say it. I want to make sure I get it right. And she's running for Congress in Florida, but she was saying, we've normalized not having these things that every other rational society has had for a long time, right? We have normalized that. So the fact that you have to fight to keep the hospital near you open, the fact that you even have to do that is unbelievably inhumane. But we've just normalized things like that. So we've normalized accepting the fact that in the most progressive, quote unquote, state with a super majority Democrats across the board, we've normalized continuing to even consider voting for a single Democrat unless and until that bill is passed this state, right? We've normalized all those things, and that's frustrating. And that's
basically what a caste system does, right? We've normalized that, you know, if you can pay and if you look a certain way, you deserve healthcare. And if you can't and don't, then you don't deserve healthcare. So it's a dehumanizing process.
Yeah.
And CalCare would put an end to that. And, you know, we support the national efforts, of course, for Medicare for all. But we think that California is just in a unique position to get this passed, to get it implemented, to do it now. And we believe that the nation would follow. And, you know, shout out to our brothers and sisters at Whole Washington who are fighting the good fight there. And we know there's bills in other states. So I appreciate the solidarity. But yeah.
Yeah, I mean, you're right. And it is an easier fight, quite frankly. You know, you're dealing with a state legislature and, you know, a particular state's population where something like this is very popular, where the party that's supposed to be introducing this is completely in power. So this is, you know, and especially with the economy that that California has, being the 5th largest in the world, that is something that can get done here, that can provide healthcare to a lot of freaking people who need it, right? A population that desperately needs it. And it could be a model, you know, it could be all those things, which is exactly why Gavin Newsom, Anthony Rendon, and the rest of the legislature doesn't want to pass it, right? Because then they're seriously putting in jeopardy one of their biggest donor bases, and that's pharmaceutical industry and the health insurance industry. So what does Healthcare for LA have coming up as far as events, any protests or anything like that we should know about?
Well, we have every Sunday, we have CalCare office hours. And it's from 5 to 7. So you can drop in anytime from 5 to 7. Just go to Healthcare for All Los Angeles page on Facebook. And we live stream it. And you can come and ask any questions about the bill. We would love for our members of the California legislature, particularly assembly members, to come and join CalCare. We usually have a doctor and a nurse to help answer the questions. So every Sunday, 5 p.m. to 7 p.m. We have an event coming up on Monday, May 24th, 7:30 p.m. Also live on Facebook. We have Dr. Paul Song. He is an oncologist here in California. He's been a long-time champion of single payer. He's a member of Physicians for National Healthcare Program. And he's going to be talking about why a public option is no option. A public option is not single payer. I hear the terms used interchangeably. So we're super excited to have Dr. Song talk about why a public option is no option that will continue the caste system. Do not be fooled by a public option. And so that's coming up May 24th, 7:30 p.m. You can go to our website, hcala.org, and we have a calendar section. We are when we hit the streets, we want to hit it big. So definitely please check in with us.
For sure. Awesome. Well, cool. Thanks so much for coming on the show, Erika. Thanks for giving us the lowdown. Everyone make sure, you know, you visit, what is it, HCALA, Healthcare for
HCALA.org.
Check out the event calendar. It can happen. It can happen in California, but it's gonna take a massive effort. So let's be here for that when that occurs. Appreciate all the fight that y'all have over there at Healthcare for All LA. Thanks for coming on the show, Erika. We'll have to definitely have you back on really soon. Next time we get some type of update on this.
Thank you so much, Justin.
All right, Erika, take care.